Good evening, everyone. I'm Dr. Padmaja from Vijayawada, and this month being the Cancer Awareness Month. So we thought we will share some of the scientific information with you all. Cancer is a word which immediately sparks a lot of scare in everyone's mind. But when we look at the cancers that women have, gynecological, I'm not talking about the cancers of all bodies. All organs in our body have cells which are the basic unit. And depending upon which organ we are having, depending upon how much that organ is used, depending upon how much damage it sustains, depending upon how much repair capacity is there, the cells behave. So every cell is designed to work for so much, and if the repair cannot happen, it gets destroyed. But sometimes, because of abnormal repair mechanisms, the cell that is damaged does not die. It multiplies, in fact, and then instead of one abnormal cell, we have two abnormal cells. And if there is no break, these abnormal cells 2 become 4, 4 becomes 16, 16 becomes 64, and they exponentially increase in size. And that uncontrolled growth of the cells that is there is called cancer. So essentially, these are cells inside our body that are behaving abnormally. And if we look at all the cancers that are related to gynecology and women, in India, in most of the parts of the country, cervical cancer is still the most common. Breast cancer is catching up. The next common cancer is uterine cancer. Then you have cancers of the ovaries. And the rare cancers are in the tube, vulva, and other organs. The cervical cancer occurs when women get infected by a virus called human papilloma virus. Most of us have the ability to clear that virus. Unfortunately, some people, the virus integrates itself into the cervical canal and changes the cells at the cervical canal and transforms those cells into cancerous cells, and then it slowly increases. The interval between having an infection, having a precancerous lesion, and cancer is extremely long. It takes 10 to 15 years for a precancerous lesion to turn into cancer. And this gives a unique capacity for us to be able to pick up cancers in a precancerous condition. So all women need to do is go for a gynecological checkup, have a perspicuum examination done, and get a pap smear done along with HPV DNA. All women need to get this done compulsorily. And in the younger girl generation, whoever is between 9 to 14 years of age, if they take vaccination, complete the vaccination course before the first sexual contact, which is usually after marriage. If everyone does this, we can eliminate cervical cancer in India. Right now, because we are not diligent enough, our women do not come for checkup till there is a complication. Vaccination is not done. Unfortunately, every 1 hour, Indian women die of cervical cancer. This is a totally sad state of affairs, which if everyone makes a determination and goes ahead, spreads this message, we can make sure that cervical cancer is no longer a health issue and bring down all these unnecessary deaths. The next most common cancer is breast cancer. For that, mm, uh, women need to be aware of how their body feels. Usually, the incidence of this cancer is highest in the 40s and 50s. So, when women are having bath, when there is some soap on the hand and on the breast, feeling the breast, and if any painless nodule like a lump is felt, going in for a checkup after the age of 40 years, having pap smear, having a mammography done will allow us to pick up breast cancer at an early stage. The problem with breast cancer is by the time we feel a lump very big and it is painful, the cells would already have spread all over the body. The cells, once they implant and have distant metastasis, it is very difficult to kill them and it is a very traumatic process. So if it is picked up at a very early stage, when the lump is very small, it is curable in 90% of cases. The next most cancer that we come across is endometrial cancer. In women who are overweight, who have had polycystic ovaries, who have diabetes, who have highly irregular periods, in them it is important to have an annual checkup, an ultrasound scan done, and if there is persistent abnormal bleeding after the age of 40 years, have an endometrial biopsy and use medicines. This makes sure that endometrial cancer will not occur. Unfortunately, ovarian cancer is a cancer that we cannot pick up at very early stages. But when we know our body in the late 40s and 50s, if there is a sensation of bloating, pain in the tummy, lower abdomen, difficulty in eating, feeling full very quickly, and having urinary symptoms of urgency and frequency, if the woman goes for a gynecological checkup, has an ultrasound scan done, has her blood workup done, and a tumor marker done, we will be able to pick up cervical cancer in an early stage. Lot of work and research is going on in trying to pick up ovarian cancers in early stage. Unfortunately, almost 70% of ovarian cancers are picked up in late stage when it has already spread all over the body. And so the cure rates are difficult and the medications are very, very toxic. So I hope this information is useful. I'm available on BabyChakra. My code is PAMD V, and you can consult me on that. And if you can spread this message to women all over, make sure that you have pap smears, your friends undergo pap smears, your kids have HPV vaccination, have annual checkups. I'm sure working together, we can make sure that cancer of the gynecological organs is a very rarity. And I will go ahead and answer some of the questions that we have. And I have a question from Navlux Kapoor, what is the first line of treatment? It depends upon the type of cancer that is there. In cervical cancer, in young women, we can do, they can undergo surgery or they can undergo radiotherapy, and the curative rates in the stage 1 are almost 98 to 99%. So picking up early is what is very, very important. Then I have a question. What is the hardest cancer to cure? Any cancer that spreads is very difficult to cure. And out of all our gynecological cancers, we are more terrified of ovarian cancer because it spreads so fast, so much, and multi organs get involved. People want to know what are the kind of foods that cause cancer. It's not really cancer does not grow with any particular type of food, but when especially hepatic cancers occur in in a comparatively higher incidence when food is preserved, heated, reheated, the oil is in which the cooking is done is used multiple times. That means they fry and then put it aside, and it is used for 10-15 cycles. That sort of oily food that is there is supposed to increase the cancer in the gut and the liver cancer. And cancer causing foods are foods with preservatives, are foods that are cooked too much. That means like the food is fried so much that it turns into charcoal like material. So, and non-veg, when people consume a lot of non-vegetarian without having any fruits, any vegetables, any salads in their diet, they are more prone to have colon cancers. Lakshmi Mishra wanted to know, how does cancer start? So that is what I was explaining, Lakshmi, if you had listened to me before. So our cells have genes which act as brakes and prevent the cell from living forever and undergoing a programmed cell death when the repair mechanisms in them are not able to repair the damages that occur every day. So if there is an abnormality in these genes, then the cells survive more, and that is the starting point of cancer. Why do healthy people get cancer? All of us, if we live long enough, that means with aging, the repair process in the cells also ages. So when the cells undergo damage and they're not repaired, they have abnormal genetic expression, and that is when they have cancer. And some of these cancer genes we inherit from our parents and our grandparents. So that is the reason why some healthy people get cancer. And other thing, we might be living healthily, but with increasing toxins in the environment, increasing pollution that is there, increasing chemicals that are getting into our food chain, all the change in the groundwater and contamination, all these also cause cancer. Durga Selvi wanted to know, what is the most common cancer in women? In Indian women, cervical cancer tops the list. Next comes breast cancer. The third incidence is oral and colon cancers. Then then we have most probably the endometrial cancer, liver cancer, lung cancer, ovarian cancer. They are there in this incidence. Revati wanted to know if stage 4 cancer is always terminal. Stage 4 cancer means whichever organ it is. If the cancer is confined to that organ, it is called stage 1. If it spreads a little outside the organ, it is stage 2. If it is going into the lymph nodes and spreading outside, it is called stage 3. Stage 4 means the cancer cells have got into the blood circulation and they are there in distant organs. That means if it's an ovarian cancer, the cells of those cancer have managed to migrate into the body and they're there in the liver, they're there in the brain, they're there in the bone marrow. So when these cancer cells go into all the organs, whichever organ they go into, they will start growing there. So they take over those organs, and then all these organs will also cause damage. So stage 4 cancer indicates that it has spread to all over the body, and definitely it will lead to its chance of being cured is very less, unless it's a leukemia or lymphoma, which are still curable and responsive to chemotherapy. And it means that the 5-year survivals in these people are very less. Kavita wants to know what are the chances of a woman getting cancer. So as I was telling you, the chance of getting cancer depends upon how well we look after ourselves and how frequently we are having a checkup with a doctor. So if a woman is maintaining her weight, not eating junk food, exercising adequately, having salads, fruits, sprouts in the diet, not using food with lot of preservatives, having a pap smear done annually, having a breast examination done by herself, and if an abnormality, consulting the doctor in time, having a mammography from the age of 40 years, having an annual ultrasound, and colonoscopy from the age of 50 years, the chance of her getting cancer are very unlikely. Then women can live healthily up to the age of 80 without cancer, and age related processes will occur. Sonam wanted to know the most deadly cancer. I think sarcomas are the most deadly cancers because they grow pretty fast. They spread into the different organ systems by blood. So these cancers are pretty aggressive, and they are the ones that spread fastest. So if there are no more questions, I have one more question. What is the third line of treatment? The first line of treatment, if the cancer is confined to the organ, it is usually surgery. The second line of treatment, especially in cervical cancers, are radiotherapy, where intracavitary and external radiation is given. Radiation is basically high intensity energy that is passed, that causes damage to the cells that are growing most rapidly. And since cancer cells grow fastest, these cells get destroyed, and we give time for the normal tissues to recover before giving another course of chemotherapy. So there is a fixed set of energy things which the latest protocols are given by the radiotherapists. The third line is chemotherapy, where different molecules that are utilized by different growing cells are given, And those molecules damage the DNA of the cells that are growing most rapidly. And but the problem is they also damage normal tissues. So a course is given, and then a 3 weeks break is given, so that the normal tissue recovers. And we look at how well the normal tissue is recovering by doing a complete blood picture, looking at the leukocytes, looking at the platelets, looking at the liver function test, looking at the kidney function test, and a urine examination. And then we give a chemotherapy again. So usually 6 cycles like that chemotherapy is given, where you, and we also monitor the cancer, how much the growth is the size of the growth decreasing. And later PET scans are done to see if the distant metastases are also decreasing. We also have advanced technology to see how much oxygen is being consumed by that, because that indicates the growth of the tumor. And based on that, the 5-year survival, the regular follow-up initially is done once in a month, then once in 3 months, once in 6 months, once in a year. Like that, we prolong and improve the quality and of life for the people who do have cancer. Vidhu Sagar says, always worried about getting cancer. I think, Vidhu, we should be very practical about it. If there is a family history of breast cancer, that means in your mother, her sisters, father, their sisters, or grandparents, if anyone has had cancer at less than 40 years age, then it is very important that women finish having their babies at a young age. Every child that you have is breastfed for exclusively breastfed for 6 months, and continue breastfeeding till the age of 3 years. That will dramatically get down the risk of cancer. If we are worried about it, whether we've inherited a gene mutation, then BRCA gene mutations can be tested. The best thing is, if there is a cancer in the family, get the genetic profiling done of that cancer, and you can have a cohort screening of the entire family, whether you share that mutation of that cancer gene with your cousin or someone who's had a cancer, or with your mother who's had a cancer. And if you share that cancer gene, it does not mean that you will 100% get cancer. It means that you are on a regular screening program to pick up cancer at the earliest. And especially for breast cancer, now we have risk reductive surgeries. That means, because these cancers are dependent on hormones, that means they're dependent on estrogen, they're dependent on progesterone, and these hormones are coming from the ovary. Once the woman completes her family, then what you can do is have a surgery where the ovaries are removed, where the tubes are removed. Then the risk of cancer comes down. I don't know if you've heard about sometime back, the story about Angelina Jolie, who has a mutation of the BRCA gene, whose mother passed away with cancer at a very young age, and she very boldly went ahead and got her uterus, tubes, ovaries removed, along with removal of the breasts, and she is now totally risk-free of these most deadly cancers. So that, I felt, was a little drastic measure, but it is an individual choice that you can talk to your doctor. What I strongly recommend is that every woman should have a pap smear done. Every girl child should be vaccinated for HPV, which is the virus which causes 95% of the cervical cancers. Get an annual checkup done. Maintain an optimal weight. Make sure you're not overweight. Make sure that you have a regular exercise. Do not smoke. If your partner smokes, make them quit smoking. Try to use as much organic vegetables. Grow your vegetables in your kitchen garden. Do not heat food too many times. Don't eat food with lot of preservatives. Make sure that you have 2 helpings of fruits every day. Make sure that you take lots of green leafy vegetables. And in fact, Indian diet and Indian spices are supposed to cut down the risk of cancer. Garlic has anti-cancer chemicals. Ginger has anti-cancer chemicals. Turmeric, which has curcumin, has a lot of anti-cancer chemicals. Tomato with lycopene has a lot of anti-cancer chemicals. Sprouts with lot of B complex have chemicals that repair damages. So these sort of foods, if we take regularly, have annual mammography from the age of 40 years, and do not wait till you fall ill to go to a doctor. You think my body is behaving differently and you have a suspicion, go for a checkup before it becomes very severe. With all these, I am sure that we can make sure that women don't get cancer at least in a late stage. And if there is a cancer also, we pick it up in an early stage where it has not spread to the rest of the system and it is curable. And I'm available on BabyChakra even for consultation. My referral code is PADV. You can always get back to me. And I hope this session was useful for you all. And mm, uh, it helps you people realize the importance of your health. And please stay healthy, and we work together to make sure that women don't have cancers. And if at all you have a family history and a genetic risk of cancer, do get on to a screening program with the consultation of your gynecologist, so that cancers can be picked up even in the precancerous phase. That means the body is changing and the cancer has not yet started, and curative and remedial measures are there for quite a large number of cancers, even in the precancerous phase. If there is a cancer, it can be cured in the early stage. And have a good family support system and have a good immunity. Our immune system also is on the lookout for abnormal cells most of the time. If there is an abnormal cell, it tries to destroy that cell. And that is the way, in spite of so much cellular damage happening to ourselves, all of us don't get cancer. If we were not having that immune system, 70% of us would be having cancer. So I hope that this message you everyone will spread to all your friends, and do look after your health and stay healthy, stay safe. And do get back to us, and you can consult me on BabyChakra at my Code is PADV. Thank you. Good day. Stay safe. Stay healthy.